Jamie, will you go to the just presentation mode? Great. Okay, 3, 2. Hi, everyone. Thank you so much for joining session 3 of the UCSF's Collaborative to Advise on Reopening Education Safely. We're just going to take a couple minutes to let all of the attendees filter in. Next slide. We do have interpretation services available for you down at the bottom, as well as closed captioning. Please do take advantage of that and sit tight while we prepare to get started. Thank you. Hi, attendees. Thank you so much for joining us for session 3 of the UCSF Cares webinar series. We're just waiting for all the attendees to filter in before we go ahead and get started. We do have closed captioning and interpretation services available down at the bottom of the screen. If you'd like to take advantage of those, we welcome you to do so. And we'll get started here in just a minute or two. Thank you. Hi, everyone. Thank you again for joining us. We're gonna wait just a little bit longer for all of the attendees to filter in before we go ahead and get started. Thank you.
Hi, everyone. Thank you for joining us for our third UCSF Cares webinars. This series of webinars from our UCSF experts were meant to inform school administrators, teachers, parents, physicians, nurses, and all interested on the impact of COVID-19 on schools and reopening. Today, we turn our attention to supporting children during remote learning with an emphasis on equity and mental health. The data is now clear that COVID impacts communities of color at disproportionate rates to our white communities and those who can afford to work from home. A significant driver is that communities of color have significantly higher essential workers or those who cannot afford to shelter in place. Our country's infrastructure, including the educational system, is challenged by inequities, and COVID-19 and the required accommodations are exacerbating these inequities. The impact of requiring distance learning has also been shown to leave behind Black and Brown children and those with special healthcare needs. The critical role schools play in the lives of children has become even more apparent in this crisis. Besides providing education for our children, schools serve as safety nets, they feed our children, they provide mental health and social support. In this current time of distance learning, how can we support all children so that they succeed? Today, we're going to hear from some of our experts on this topic who will build on the information that we have learned so far in our previous webinars. Our panel today consists of Dr. Matt Pantell, an assistant professor of pediatric hospital medicine and a core faculty in the Center for Health and Community. Ms. Melanie Callen, a child and development educational specialist at Zuckerberg San Francisco General Hospital as part of their multidisciplinary assessment center. And Dr. Petra Steinbuchel, an associate professor of psychiatry and the director of the UCSF Child and Adolescent Psychiatry Portal. We will have an opportunity for question and answer after their presentation, and Dr. Pantell is going to kick us off.
Thank you, Dr. Atkinson-McAvoy. All right, well, today I'll be talking to you about remote learning during the time of COVID-19 and understanding the social context of the at-home learning environment and disparities in learning technology access. Next slide, please. So as Dr. Atkinson-McAvoy mentioned, coronavirus has been affecting our population now for a very long time, and disproportionately some compared to others. As of this morning, at least 168,000 people have died from COVID-19 in the United States, according to the Washington Post, and nearly 5.5 million cases have been reported. Next slide, please. As with many other diseases and medical conditions, there are disheartening disparities in how coronavirus is affecting different communities. In a recent study of counties identified as hotspots during the middle of June, the authors concluded that there was a disproportionate incidence of COVID-19 among communities of color, and especially among Hispanic and Black patients. These findings align with other data indicating that Black patients are overrepresented among COVID-19 hospitalizations and deaths in the United States. Next slide, please. More locally, in a study of nearly 4,000 people living in the Mission District in April and May, a study team that included UCSF researchers found that infection rates were 20-fold higher in Latinx versus non-Latinx participants. Additionally, researchers found that there were disparities by frontline worker status and by income. Among the positive cases, 90% of patients worked in jobs where they could not work from home, and 88.9% of patients had annual incomes of less than $50,000. Next slide, please. In addition to the health consequences of COVID-19, there have also been substantial economic consequences. During the pandemic, social needs such as food insecurity, healthcare coverage, and unemployment benefits have been increasing quite drastically. Recent work done by the Brookings Institution demonstrates how food insecurity has changed during the pandemic. Looking at the right side of the screen and 3 bars on the right, the black line represents 2018 estimates of food insecurity among all households with children under 18, and mothers with children 12 and under. As you could see, whereas roughly 15% of mothers with children 12 and under endorsed food insecurity in 2018, as of April this year, it was roughly 41% of mothers with children under 12. The orange bar on the left represents children, as opposed to adults living with children that are experiencing food insecurity. And while this number was 3.4% in 2018, it was 17.4% in April. Next slide, please. Similar to the health disparities experienced with COVID-19, there are also disparities in experiencing social needs. In California, higher proportions of Black and Hispanic households reported experiencing food insecurity as of June. Next slide, please. Additionally, there are socioeconomic disparities in experiencing social needs, with roughly 72.1% of households with school-age children and a household income less than $40,000 a year reporting experiencing food insecurity in June, versus 7.3% of those with household incomes greater than $100,000 a year. And next slide, please. In a survey conducted by the Pew Research Center, unemployment rates have varied by race and ethnicity, with Asian, Black, and Hispanic men and women experiencing higher rates of unemployment than white men and women. As you can see, compared to that yellow bar on the right side of each of the bar graphs, many of these unemployment rates by race and ethnicity are even greater than the recession during the late 2000s. Next slide, please. With the backdrop of disparities in health outcomes and social needs, there have been concerns about disparities in access to learning technology that has been that have been and are being implemented. Next slide, please. Looking at the left side here, in a survey of school district leaders in March across the country, the higher the proportion of low-income students that the district served, the more likely that district leaders were to endorse technology access being a major challenge to teaching during COVID-19 closures. Looking at California, over the summer, it was estimated that nearly 1 in 3 school-age children lacked access to robust broadband networks needed to effectively engage in remote learning. And several weeks ago, the California Department of Education estimated that nearly 700,000 students were still without the technology needed in order to participate in online classes while schools are closed for in-person instruction. Next slide, please. Now looking at California, but specifically at the LA Unified School District, I'll tell you that the LAUSD loaned tablets and laptops to students and provided many of them access to a program called Schoolology, an online course management system or virtual classroom. Students use this as well as other platforms to communicate with teachers, access course contents, and complete assignments during school closures that began in March. In a report of the Independent Analysis Unit of the LAUSD, they measured student activity and categorized a hierarchy of engagement. Participation was when students submitted assignments, took tests, posted to discussion boards, or created a message. And this represented the highest level of engagement in online class. Viewed content represented when students accessed a reading, instructions, or video, but did not participate. A session only was the minimal level of activity, entailing logging in and little else. And then absent or inactive was when students completed none of the actions listed above. They tracked this activity among students over several weeks and found that at both the beginning and end of the study period, in both middle and high school, students that were English learners were less likely to access materials than students that were proficient in English. And what you can see here, taking the first picture on the left, this is among English learners in middle school. And starting in week 1, and again, this is a 9-week period, about 34% of students were participating. And at the end of the time, 48% were participating. Again, participating being the most actively engaged. This is compared to a middle school 56% at the start and 67% at the end. Again, the lighter blue lines represent less active participation, and those levels vary accordingly as well. Among high school students, the percent of students began at 49% in terms of participation in week 1 and ended at 48% among English learners versus 72% at the beginning and 66% at the end among English proficient students. Similar disparities emerged when comparing students living in low-income households compared to non-low-income households, and comparing students with disabilities to those without disabilities, and also comparing students living with housing instability or in foster care compared to their peers. And next slide, please. We also see the disparity across race and ethnicity, with Black and Hispanic students being less likely to participate in Schoolology activities compared to their white peers. Looking at this, which is specific to middle school, you could see that at the beginning of Schoolology, 44% of Black students were participating compared to 77% of white students, and then at the end, 60% versus 82%. Similarly, Hispanic students, 48% were participating versus 61% at the end. Next slide, please. Looking at San Francisco, our providers at San Francisco General Hospital in the outpatient setting were actually screening patients that they called or saw for primary care visits during the summer. Providers incorporated the following question into their visits. Are there barriers to your children engaging with school resources like online classroom meetings and assignments? What we found when analyzing this data is that Hispanic patients' caregivers were twice as likely to respond yes, and non-English speaking patients' caregivers had a 19% increased odds of digital access issue. Next slide, please. While local school districts, including Oakland and San Francisco Unified School District, have been providing learning resources, there are still students in need. An estimated 7,000 of 35,000 of Oakland Unified School District students lacked equipment and hotspots on the first day of school, and this was reported last week. Next slide, please. There are resources available, though, to try to address these disparities in access to learning resources. California has been trying to make internet-enabled tablets more available. And again, in local school districts, there are programs and there have been donors locally that have been trying to get students the equipment that they need. Additionally, the San Francisco General Hospital Health Advocates Program, which helps to give patients resources to address social needs, has put together a list of resources to address social needs, including food insecurity and access to learning technology that we can distribute via the website after this presentation. Next slide, please. So for take-home points, when engaging with learners during this time, it's important to consider the wider family context and how it may be interacting with learning at home. Many families with children are facing increased hardship, and there are disparities in social stressors by race, ethnicity, and socioeconomic factors. There may continue to be barriers to accessing learning technology. Some students may be at higher risk for access barriers based on preliminary data. And what we have found thus far is that Black students, Hispanic students, students living in low-income households, those classified as English learners, those living with a disability, those experiencing housing instability or living in foster care have had lower access to learning technology. And finally, there are resources to help address digital and social needs, those that I've outlined at the previous slide, which we'll make available after this talk. Next slide, please. Now it's my pleasure to introduce Miss Melanie Callen.
Thank you, Matt. Dr. Pantell. Okay. Hello, next slide, please. Next slide, please.
Sorry about that, Melanie. It looks like Jamie's internet just went out. We will
Okay.
pull up if you want to give your intro, we can pull up the version of the slides.
Am I being
now.
recorded right now?
Yeah.
Perfect. So my name is Melanie Callen, and I work at UCSF and San Francisco General Hospital. And I am going to focus on remote learning challenges and considerations within a framework of educational equity, which I will define as fairness, inclusion, and equal access to learning opportunities for all students across socioeconomic, racial, ethnic, cultural, and linguistic groups, as well as for children with special needs.
I am sharing my screen now.
Sure. Perfect. Thank you. So there have been long-standing systemic inequities in our health, social, and educational systems, which have contributed to disparate achievement. This graph shows the percentage of fourth grade students by race and ethnicity scoring at the below basic level of math achievement over an almost 20-year period. Next slide, please. Here is an overview of the ecosystems and factors within each system that often interfere with learning and achievement. I will highlight a few risk factors, including family experience and exposure to trauma, issues related to housing, caregiver health and support, immigration and legal status, family discord or violence at home, abuse, and stress. Within one's community, there may be neighborhood crime, environmental risk factors, including poor sanitation and unsafe public spaces, lack of available health and social services, poor public transportation, and limited access to recreational activities. School barriers may include lack of experiences with preschool and daycare, as well as early intervention services, a poor school climate, limited funding, inadequate assessment and support services, as well as the challenge of needing to label students in order to obtain special categorical funding for access to special education. Peer risk factors influencing academic achievement include social connectedness and relationships to peers at school. Next slide, please. We must not forget to highlight the center of the ecosystem, which is the child. Individual vulnerabilities and or disabilities may include medical conditions, developmental disabilities, learning differences, ADHD, autism spectrum disorder, emotional and behavioral disorders, health impairments impacting access to education, such as hearing, vision, asthma, and poor nutrition, in addition to a child's experience of racial, ethnic, and or gender bias. Next slide, please. COVID-19 impacts all of these ecosystems. And as Dr. Pantell spoke of, its effects have been profound on our most vulnerable communities and students. Next slide, please. Schools serve as critical environments for social and emotional connection, social learning, and meaningful relationships. Participation at school facilitates the identification of students with academic, behavioral, and social emotional needs. Next slide, please. With school closures, students miss out on many learning opportunities. Remote learning limits teachers' and staff's ability to notice and document when a student might be struggling and require further assessment and intervention. Learning regression is a huge and valid concern, especially given the variability of access to education during the past spring semester and summer break. Next slide, please. I want to review California Senate Bill 98, which provides updated requirements for distance learning. I've highlighted a few key points on my slide. For the last item, if daily live interaction for instruction, monitoring, and maintaining school connectedness is not feasible, the local education agency is to take parent input into consideration to develop an alternative plan for frequent live interaction, providing a comparable level of service and school connectedness. Next slide, please. There's a lot of information on this slide, which can be reviewed once posted online. The overarching message here is that timelines and services must be followed during COVID. These are recently updated U.S. Department of Education and federal disability laws. We want to ensure we are still identifying and referring infants, children, and youth in need of assessment and intervention services through our local regional centers and school districts. Accessibility is paramount, and if appropriate, compensatory services may be warranted. Next slide, please. COVID has only amplified disparities for our children and families of color, low socioeconomic status, those who are non-English speaking, and those with special healthcare needs. These factors add additional challenges to access and equity in education. I'd like to highlight again the digital divide, as well as the increased risk of adjustment and mood disorders, as well as anxiety and suicidal ideation, which Dr. Steinbuchel will be discussing in her presentation. Next slide, please. I will let these images speak for themselves regarding distance learning and what it actually looks and feels like. Next slide, please. We know that even before school closures, the most vulnerable and highest need population of students were not necessarily receiving rigorous, engaging, and positive educational experiences. Recent research emphasizes some of the inequities for students of color. Next slide, please. What can families do? Identify barriers. I want and hope that providers also ask this as well when communicating with patients and families. Barriers may include technology and internet access, physical space constraints and challenges, noise interference, child and or family anxiety, and language factors. Families should ask the school about their plans related to measuring grade level performance, as state level assessments have been suspended during COVID. This may negatively impact critical data collection that may be used to help advance equity and determine resource needs. Next slide, please. For all students, especially those with IEPs and specialized learning or behavioral needs, document the student's experience and the school's response. Consider also asking if the school could provide online training for instructional support or therapy, such as physical therapy or occupational therapy. Next slide, please. Expect distraction, disengagement, and disorganization for many students, but particularly younger students and those with attentional challenges. Adhering to a daily schedule while being mindful of the family and child's needs and asking the child for input can be helpful. Provide breaks for snacks or meals, music, exercise, and outside time if available. Check in with children to help them identify and work through their feelings using visual cues. Also, remember to recognize your state, mood, and zone, as you are not just a parent or guardian, but now also a teacher, therapist, and school administrator. Next slide, please. Remember to adapt and require the school to do the same. Most importantly, be empathic to your child, your teachers, school specialists, our community, and yourself. Thank you very much. I would like to introduce Dr. Steinbuchel.
Thank you so much. It's really a pleasure to be here and really appreciate the broad overview that you all have given. And if we go to the next slide, please. So this is from Trauma Transformed, which is a 7-county Bay Area initiative that was launched in 2015 that put forth this this understanding when COVID and quarantine was really starting to get active in March of this year. And just want to highlight that we've been in this now for 5 months and we've experienced significant loss of routine structures and schedules. We've had an increased sense of timelessness. There are no clear timestamps between the weekdays, the weekends, between seasons, end of school, beginning of school. And we've been experiencing varying degrees of loss of connection with others and sometimes also a loss of purpose. We've had significant grief about missed experiences, including usual rituals, milestones like graduations, birthdays, weddings, as well as many other senses of loss, including not being able to see family members and loved ones. And so with this, we would like you to reflect on these principles. Next slide, please. So what is the overall impact on our mental health? We know that, that we are experiencing increased stress, and the U.S. National Center of Health Statistics and the U.S. Census Bureau conducted weekly household pulse surveys starting in April and have been doing these weekly, and these are 20-minute surveys. And this is an estimate for the week of July 16th through 21st. there are significantly higher rates of anxiety, depression, and combined anxiety and depression as measured by PHQ-2s and GAD-7s. And in contrast to this, which shows both depression and anxiety rates around 44% during this week in July, and anxiety around 39% and depression at 31%. In contrast, during a similar period, January through June of 2019, the rates of anxiety were about 8.2% and depression about 6% and 11% for both. So there's a significant increase. There was a study published in Pediatrics this spring on youth in Shanxi, China, ages 3 to 18, where there were significant rates of sleep difficulty at 25% and symptoms of irritability and inattention at over 30%. There were also significantly increased divorce rates just after quarantine ended during this time. And we know that from past major disasters that there have been increased rates of PTSD in those quarantined, especially when there's been limited communication about next steps and a lot of uncertainty. We also know that rates of alcohol sales increased by 55% in the United States just in the week of March 20th. Next slide, please. Amidst all of this and job losses and financial insecurity, we've had disproportionate rates of contracting and becoming seriously ill from COVID, as well as nationwide protests in response to centuries of racial injustice and anti-Black racism. And the past few months have only exacerbated the already disparate mental health needs of many Black, Indigenous, and non-Black persons of color. In particular, BIPOC students are experiencing all of these traumas on top of the isolation of social distancing and remote learning. For many young people, school is the primary provider of mental health resources, so school closures have significantly impacted this group. There's also been a significant increase in overt discrimination and racism directed towards American Asians and Pacific Islanders, including use of the term China virus. Next slide, please. Amidst all of this, we have been watching, reading, often awake until very late at night, trying to find more information, trying to look into that crystal ball, what will the future hold, trying to manage our feelings of uncertainty and unease and fear, and looking for some kind of way to predict the future. We know that media exposure, especially in our current 24/7 media news cycle, can increase perceptions around threat and activate our fight or flight response, which can lead to subsequent physical and mental health problems. And we know that from past disasters, for example, excessive media exposure during and just after 9/11 was associated with increased PTSD and new onset physical health problems even 2 to 3 years later. And high stress response rates were associated with more cardiovascular ailments over the 3 years after the attacks. Similarly, during the Ebola outbreak in 2014, more people were significantly experiencing increasing distress and worry, as well as poor functioning compared with those who consumed less media. Next slide, please. So this is a representation of kind of the normal fluctuation of our autonomic nervous system. Our sympathetic nervous system, which is often called our fight or flight response system, involves automatic involuntary processes and responses to stress. And then our parasympathetic nervous system is our rest and digest. It's kind of putting the brake on compared with the gas pedal of the sympathetic nervous system. And normally these are in a healthy balance. However, when we experience significant stress, we can have more significant fluctuation between these two as the body tries to self-regulate and find some balance. So when you get overactivation of your sympathetic nervous system, you can feel overstimulated, have insomnia, hypervigilance, irritability, anxiety, and eventually your parasympathetic nervous system tries to calm down the stress response, and you may get stuck in more of an off mode. So this is associated with symptoms of being more fatigued, tired, maybe feeling numb or shut down, and symptoms of what's called dissociation. Basically, you're feeling more frozen and exhausted. Next slide, please. So have you ever noticed that panic or anxiety can feel contagious? When you're around other people who feel it, you may pick up on that and start to feel that way yourself. Kids are especially vulnerable to this, and they take their cues from the adults around them. So parents are often feeling more stressed, not only for financial reasons, but also because of their limited ability to act and maybe have a sense of agency or control over what's happening. And this may be even worse in those who've experienced past trauma. So this collective increased danger, or the perception of it, can increase vicarious trauma in all of us and contribute to burnout. In order to help mitigate that, it's really important to try and activate that rest and digest system as much as possible. And you can do this through really small interventions, things like taking deep breaths, in particular where the out breath is a little bit longer than the in breath. That helps to activate that parasympathetic nervous system response. You think about it, if you're trying to get a lot of oxygen, trying to run away from that lion and the activation of the fight or flight response, if you kind of trick yourself and exhale longer, that means you can relax and exhale. It's important to also just take small breaks during the day. This can be even 60 to 90 seconds. And also in those moments, being able to give name or voice to the feelings that you're experiencing. We know that if you can just name it, you can often tame your emotions more easily. It's also helpful to engage in a self-care activity that engages your kindness, feeling that you are able to be kind to others and also experience a sense of gratitude can really help with managing stress. Next slide, please. So what's the overall impact currently on child and adolescent mental health? There's really a paucity of literature currently. Most of the articles are editorials or opinion articles and some exploratory data analyses. And then a lot of this is based on what we're seeing in clinical practice. We see that many adults are sleeping less than usual, and some kids are sleeping less than usual. Some of them are actually sleeping more than usual because there's no need to commute. They have decreased activities. And we are seeing that some children, in particular those with social anxiety, are in some ways doing much better. There's much less academic pressure, or at least there has been, and that may change as we're starting school right now. But we know that they've also experienced kind of less social stress, and for some people that feels better. However, in going back to school, we're also seeing increased anxiety even around being on Zoom meetings and on the camera and needing to present in front of their peers. Other kids with anxiety may struggle to be more assertive interpersonally around navigating relationships. They may feel pressure to hang out and spend time with friends when maybe they don't feel safe interacting with groups of children getting together. We've also seen that some hyperactive kids are doing better in certain ways because they're not getting into trouble for being the class clown, and they can manage their wiggles and fidgets at home. That said, children with attentional problems are really seeming to struggle, in particular with virtual formats. And so consistent with what Ms. Callen was describing about really having clear expectations, visibly posted schedule, being able to take frequent breaks is really critical, and using things like a timer to make sure that you're staying on track. We're also seeing increased depression, in particular for those who have been more socially isolated and have described things like, I've been staring at the same four walls, just doing my schoolwork, and they may be experiencing boredom and fatigue. We're also seeing many periodical posts about how challenging things are for children across the board, that there's been more regression across all ages, more clinginess, whininess in younger children. Only children in particular seem to be showing more fantasy play. And this is all, you know, it may be striking to parents, but knowing that this can be expected given the social isolation. We are wired to be social beings and to connect with others, and this is really challenging across the board. There's also speculation around concern for increased rates of child abuse due to so much family together time, And the actual reports of this seem to be down currently, but we know that there's also the loss of usual kind of reporting mechanisms through school and other adults that would interact with a child and may be able to notice symptoms of abuse. Other disorders, including eating disorders, there may be an increased risk of those because of worry about loss of physical activity and also lots of time spent on camera, receiving messages about their body image. We know that children with neurodevelopmental disorders, many of them have experienced a loss of usual programming and activities and schools that have really posed a challenge for some families needing to manage all of these things at home. Additionally, with the many youth in California who are at risk for homelessness, that they may not be accessing their usual mechanisms of care, mental health support, and maybe struggling, but also maybe hiding those things from adults. Next slide, please. So this image is one that I really love to use a lot clinically. And just looking below the surface of behavior to know that there is often much going on that drives behavior, and that this is a question of lack of skill or ability in the moment because of how you're feeling that drives behavior. And so if someone is acting willful or defiant, refusing to engage in another Zoom session, to be curious about what's going on and try to understand and connect rather than before getting angry about it and before reacting. And this anger iceberg shows that often what looks like anger can actually belie many different complicated feelings, often ones related to anxiety. Next slide. So what can we do for younger children? I included this feelings chart because younger children have found it very helpful to have some kind of grounding ritual that includes a check-in that is relational. Being able to identify how they're feeling and share it with others is really important and doesn't need to take much time. We also need to hold the expectation of younger children in particular that they're capable and competent, that they can do this, they can figure out the virtual formats, and with scaffolded support to help get them there. We need to have consistent, calm consequences and also have some ability to have special time. That can be with a trusted caregiver, or also to consider having a little bit of one-on-one time with a teacher at some kind of regular interval to help cultivate that relationship and make sure that they feel seen and heard. Being able to give praise that's really specific and clear about what exactly was done well, rather than just being able to say good job. And then wherever possible, and knowing that we are limited in many ways of doing this, but being able to find avenues for attuned, meaning you are aware of how the other person may be feeling, what's going on with them. Reciprocal, so back and forth, being able to build upon what is said, and contingent communication. And this is really critical for learning and growth for all developing minds across the lifespan, but in particular for children. Next slide, please. Adolescents really seem to be struggling almost more than other groups right now. They have been, at a place where they are socially isolated just at a time when they're really needing to connect with peers more than ever. This is a normal developmental process, is to be able to what's called separate and individuate from their families and be able to make deeper connections with their peers. And that is significantly stymied currently. They also are prone to take increased risks and to have kind of a feeling of invincibility. And so they may worry less about the risk of contracting COVID, and they may also not consider as carefully what the impact would be on other people if they were to contract it. In terms of being able to develop peer connections, this seems to be really key to their identity formation, trying on different hats, and being able to figure out and test out who they are that is different from their family of origin. They really need to have kind of clear, honest communication and separate times for check-ins that may be just one-on-one, where they can share and be vulnerable. but also to respect the fact that they may not want to do that. They need to have clear expectations, and this can include being able to contribute to the community that is your home, and just continue to hold that expectation and not just spend 12 hours a day locked in your room attached to a screen. Next slide, please. So in summary, wanting to invite us to start with heart and have empathy for ourselves in this process, knowing that we are all experiencing some degree of stress and vicarious trauma potentially, and looking for steadiness in this, not perfection. Perfection is not the goal. We need to have a mindset of we're going to get through this together, and really rely heavily on the power of connection, of being with rather than doing with connecting with teachers, and really supporting the power of relationship in terms of learning. These, like I said earlier, these could be brief one-on-one meetings, but the idea is really to feel seen and to be known. We also need to look at validating feelings, validating worry. There are no bad emotions in this. All thoughts and feelings are valid, and being able to look at what is reasonable in this moment. For this reason, there's no reason to pressure children to avoid or dismiss negative emotions. My daughter told her teacher as we picked up book supplies on the first day, I really don't like coronavirus. And her teacher said, well, it's not going to last forever, and we will get through this. It's normal to feel like you don't like this right now. You may remember this moment in time forever, and you may even tell your grandchildren about it, but we will get through this. So being able to convey a sense of optimism. It's also really important to set clear expectations and ideally set goals for the year that include both strengths and struggles, and to involve the child or teen in this process. And I love this picture. This is a family in Woodbridge, Virginia, who created their own Spirit Week when quarantine first started in the spring of 2020. And it really holds out the idea that we need to continue to try and have fun and to keep up a sense of optimism. Next slide, please. And this is just a reminder for all of us to take a break from the screens, and that being outside has significant benefits for those who are able to access any kind of outdoor or green space. We know that it can improve our concentration and attention and our mood. And just anecdotally, the persons that I have seen in the past couple of months have said, the only time my adolescent talked to me is when we went camping and we were forced to be together, and there's a lot more kind of interactive component to that. Next slide, please. So this is based more on advocacy and thinking about at the local, regional, and state and federal levels to address in particular mental health needs of students in discrete populations. So for Native student mental health, we need to really focus on recruitment of counselors and persons within tribal culture or who are part of it, who can deeply understand these students' needs. Be able to have greater accessibility of telehealth in remote areas, and also federal investment in Native education. For Latinx students, we need to support recruitment in similar ways, and also have support for undocumented students and families and resources about citizenship, as well as federal funding to address family economic instability. Next slide. For Black student mental health, to really have specific programming aimed at mental health stigma and reducing it. And similarly, recruitment of Black counselors, social workers, and mental health professionals, as well as federal funding for anti-racist and trauma-informed mental health practices across the board. And then for American, Asian, and Pacific Islander student mental health, we want to ensure that there are anti-racist and anti-bullying programs and increase state and district-wide racially and ethnically disaggregated data that includes subgroups, as well as federal funding for trainings in PTSD and other immigration competency for providers. With that, I will turn it back over to Lee. Thank you.
Thank you all for such an enlightening presentation on really the challenges with distance learning and some of the data. So moving to some of the questions that have come up in the chat. Dr. Pantell, are the disparities that you spoke of persistent over the course of the pandemic, or are they worsening?
Yeah, that's a great question. And there's still, we're still aggregating data from a lot of different sources about it. And I can say that one of the best ones that I've seen that provides data both in a lot of different states and even some cities, and includes California and population level estimates as well as national estimates, is something called the COVID survey. And what they've found, particularly looking at social needs, is that, for example, food insecurity has had a slight decrease. So they surveyed in April, and it was 23% of all households. And then in May, it was 22%. And then in June, it was 20%. So slight decreases, although no mention of sort of statistical significance. How that varies by different racial and ethnic groups, as well as socioeconomic status, they haven't quite parsed out, although that data is available to look at as well. And I'll say for the access to learning technology, the report from the group in LAUSD did show sort of over this 9-week period that they were looking at this, sort of very consistent pattern, sort of starting a little bit lower in terms of everybody's participation, then sort of getting a little bit to a peak and then going lower at the end. But pretty much the disparities were staying similar throughout that time.
Thank you. Ms. Callen, referrals are being made for assessments, but the professionals who conduct those referrals can't come to schools for observations. Do you have suggestions for how they can safely complete assessments, such as vision, hearing, and developmental assessments?
So it is difficult, and I think something that I know we've been doing here at San Francisco General is to do telehealth, and so virtual visits. We are doing some inpatient visits, in-person visits for outpatient care. So I do think it is still very critical and important, although I will say that a number of agencies and school districts are willing to put aside some of the standardized tests or in-person assessments that are typically required to proceed with screening and assessment. So I have recommended to families that they ask for consent so that their provider can communicate with them, being it the school district or a local early intervention agency.
Thanks. Dr. Steinbuchel, how can pediatric health care providers advocate for children and youth efficiently and effectively in school when we may not be aware of the resources that are available and the stressors that might be happening? Are there ways that we can do this to get better results, and any best practices for collaboration between physicians and education?
It's a great question. I don't know if I have all of the answers at the ready, but I think that that in terms of being able to advocate for children in school, this is such a difficult balance between ensuring physical safety and also looking at, you know, mental health and development, normal social emotional milestones being gained, and so it feels like it's, you know, the one at the expense of the other, and I think that, you know, we can only take the small steps that we are right now with looking at having kids socialize with masks in smaller groups and really being as safe as possible in the ways that were outlined in previous talks. I think that being able to deepen relationships between, you know, the healthcare workers that do exist at schools. Not all schools have them, but I think strengthening those relationships is particularly important right now as one small way to do this, and to prioritize this learning as part of an overall picture, and knowing that, you know, the virtual format does not work for any and all children.
Thanks. Dr. Pantell, so speaking about small learning groups, we've all heard about pods, but we've also heard that pods can increase inequities. how can we balance parents wanting their children to have a social connection and social outlet, and with the need for social responsibility and to not worsen inequities that exist?
Yeah, really great question, and something that's such a dynamic situation. And I think, in terms of pods in particular, I think there could be a way to actually leverage the ability to have pods and use space to actually help ensure that these disparities are lessened. So, for example, if there isn't enough physical space to have as many pods as are needed during the week, we have preliminary data about which students might be at higher risk of not being able to engage in distance learning as well. And so if we have to have a sort of a limited number of spaces currently, prioritizing, again, based on the LA data, students that are English learners, or that are in low-income households, or students with disabilities, or living with housing instability and foster care, that could be a way to, if we have to, unfortunately, prioritize the use of space and pods within classrooms, maybe sort of using either data or using what the data we have before, trying to ensure that at least those students are prioritized. And, as much as we can, engaging actively throughout this, this semester about who might be falling more behind, and helping to sort of prioritize that they're getting access to spaces or to pods and that type of thing. So I would encourage that pods can hopefully be a tool to lessen some of those disparities if the data is used sort of wisely to help, use those spaces.
Thanks, a great answer to a really complex question. Ms. Callen, you mentioned less engagement in schools among children with developmental disabilities. I'm wondering if you have noticed any bright spots or any online programs that have worked well, and if not, if you can think of some best practices that can be employed to really help to engage children with developmental disabilities or differences.
Yes, so that is a very large and loaded question, but an incredibly important one. I think, again, I would say the documentation piece is critical. I think for some kids, it is nearly impossible to engage online. And this is where families should document and potentially request for compensatory services or an alternative plan. I will say that certain districts are looking into contracting with non-public agencies to actually allow providers to come into the home. So that would be something that you might want to inquire about. Again, I think any service or opportunity that your child has as part of their individualized education plan that they are not receiving, there needs to be an emergency IEP meeting where you can discuss and move forward with the team to plan what are best practices. So I encourage everybody to document and to request for meetings, because that holds schools and districts accountable.
Thanks. This is our last question as we're nearing the top of the hour. Dr. Steinbuchel, do you have any specific suggestions around how families can set up a productive space for their children to do distance learning?
Yes, this is a topic of great discussion and something that we just implemented in the space where our kids are learning. Ideally, trying to get it as free of distractions as possible, being able to have timers up that are hopefully quiet when they go off so that they're not stressful, but to be able to kind of set clear time for working, and then clear times for breaks, and being able to have visible reminders, as Ms. Callen had said, that show this is what's due today, teaching them how to prioritize and triage what's due today that I have to get done, what looks like it's going to be hardest, and setting that up, and then allowing them to check off when they've been able to finish something. And for kids who do have trouble sitting still, to have fidgets or bouncy chairs or something like that that they can sit on and help to manage. And, to help teach kids with anxiety, for example, how to manage some of the items on Zoom, if that's the platform that they're using, so that they can, step out if they need to. And I think also encouraging breaks, even when you're on the Zoom session, if you need to have the process feel more human.
Thank you. And Thank you for all our panelists for participating. Thank you to our entire audience for joining us on this journey. COVID-19 has really impacted us in so many ways. And as we stated at the beginning, when we learned about the impact for schools, and as we as physicians and potential experts were engaged by the community to think about how we can advise on the best practices and the evidence, was the birth of this webinar series, and we appreciate your participation. This is by no means the end. There will be more to come in the future, but this is the end of the planned sessions, really around the fact that many schools either opened last week, open this week, or opening next week. We encourage you to reach out with questions, and for everyone to know that all 3 sessions with their presentation materials are available at the website that's on the screen, coronavirus.ucsf.edu/cares. We are also working on the frequently asked questions and reports with specific advice by grade level that we will be posting coming up. And thank you for your engagement and participation. Have a good day.